Good afternoon, colleagues, and thank you very much, Dr. Sorona, for the presentation. I'll try to be brief. Now, mine is to present on prosthetics in South Africa. And if you look into literature, the World Health Organization and the World Bank estimate that 35 to 40 million people currently require prosthetic and orthotic services. And the sad part is that only 1 in 10 persons has access to such services. South Africa currently has a varying disability rate, which is reported to be 4.4, 7.5. So there's a huge variance. The profession and the service rendered by prosthetists orthotists are relatively unknown, not only in the health sector, but also by the people who could benefit from these services. The public is often unaware of their existence, what the services may provide, and consequently, they don't demand them. Currently in the country, we have 22 prosthetic and orthotic centers and approximately 850 medical prosthetists orthotists. Our country is faced with a serious shortage of prosthetic legs. The estimated backlog, this was done, the study done in 2020, the estimated backlog stands at plus minus 5,000 amputees. Now, with all the prosthetic and orthotic services located in the urban hospitals, patients from rural areas need to travel long distances to reach the centers. Now, some of the issues that amputees face: distance, a lack of transport, financial constraints, and a shortage of healthcare hamper rehabilitation in poorly resourced settings. This speaks mostly to African countries. South Africa is not excluded. Staff shortage also hampers access to prosthetic services. And to put that into context is that while the population increased in South Africa by 24.3, a study done in 2020 showed that the ratio of prosthetists orthotists increased from 0.05 to 0.09, meaning in a million population, there are only 9 prosthetists orthotists currently. Next slide, please. Now, with this slide, what I want to show is that these are the services which are provided, the lower limb processes which are provided in the public sector. Now, these are your very basic and standard prosthetic processes. Now, people, the issue with these is that there's lack of access. Like I've said earlier, the people who need these services the most, or these devices the most, stay in the rural areas, and they have to travel long distances to get to these services. And then secondly, the kind of technology being used. This is a very basic technology. Like Dr. Sorona alluded earlier, the desired technology for some amputees or most amputees is quite expensive. And the budget constraint, they make the government not to be able to provide the ideal processes in the country. However, next slide, please. However, if you look at the comparison within the same country, if you look at the comparison of what you get in the private sector versus what you get in the public sector. So the processes on the left, it's the processes that you get when you have your medical aid, or you got funding elsewhere, or through the road accident fund. Now, the private practitioners are able to manufacture for you an ideal processes, a processes that can enable you to obtain your level of performance. Now, if you look at the comparison in front of us, you will see that the difference is the suspension. On the left, they use on the right, you find your pelon suspension, which you find in the government sector. And then on the left, with the private sector, you find a sleeve. Now, as you can see, even from just the 2 pictures, the sleeve would obviously hold the leg better than what is provided on the right. If you look at the socket, the black arrows, the socket on the left is designed using a carbon fiber, which is a modern technology and which is very light, whereas on the left they use quite heavy materials, which can be heavy sometimes. Even if you look at the foot on the left is much more advanced than the foot on the right. Now, The most important thing is that when you go to private within South Africa, you get the quality prosthesis. When you go to public sector, you do get a prosthesis, which is mainly a functional prosthesis, but does not meet your desired needs. Next slide, please. Now, if you look further afield, this is another technology which you get in most African countries. Now, with this technology, as you can see, this technology, there's a lot of safety in the technology. This technology does not afford shock absorption when a patient is ambulating, and it does not mimic true human locomotion when they're using this kind of technology. Now, even the mechanism, if you look at in the picture on the right, that is supposed to be an artificial knee. However, that knee is only using one mechanism, which is the hinge, so it can only flex and extend. Now, this limits active patients in terms of attaining your ideal activity. So the situation when you go to some African countries, it becomes worse in terms of the quality of processes provided to the patients. Next slide, please. Now, like Dr. Surana explained, having access to a prosthesis, it's not luxury. Having access to a prosthesis helps you to access development opportunities. It allows you to get a job. Like the kid on the left, she's got a dream to go back to school. Having a prosthesis allows you to farm, which sustains your livelihood, allows the kids to play, and over and above, to parents, it gives them the opportunity to fight poverty. So having these devices speaks directly to person's livelihood and their families. Next slide, please. Now, with these two pictures, these are the ideal prostheses, your high-end prostheses. Dr. Surana spoke of a microprocessor knee, which costs above $500,000. So these are the kind of knees that you find in the first world countries, and in most African countries, if you need these ideal prostheses, you have to pay big monies. The government is unable to purchase these for our patient. But if you go to private, then you can get this kind of processes. Next slide, please. Now, some of the things that we do to mitigate some of these factors, which is people not being able to access these services, that is me on the picture, is that we do community outreach programs where we go and take services to the people. This lady on the picture is a lady from Port St. John's, in one of the towns in the Eastern Cape, and she stays in the rural areas of Port St. John's. We had to visit her. She's got a family, she's married, and as you know, a woman in an African setting, she's supposed to do everything. And her not having an arm does not exempt her. And what we had to do is to go and restore her dignity and also ensure that she's able to sustain her family and be a mother again. Next slide, please. With this boy, he came to us. He had a snake bite and he had lost his leg. And we made the processes for him. And when we got his processes, he said, I am so happy that I'll be able to go back to school. So having a processes, it brings back hope to people. And even with kids, it gives that hope, and it gives them the hope of being able to go back to school and becoming something one day. Next slide, please. So in conclusion, the message I want to part with you today is that a prosthesis is not just an artificial leg that replaces a missing limb. Rather, it is an instrument to obtaining economic freedom, a beacon of hope to those yet to complete their studies, and more. Like Dr. Surana alluded to earlier, it gives hope to those who are at the brink of committing suicide. So it is not just a device that is meant to replace a missing leg. Otherwise, with those few words, I'd like to thank you so much. Thank you.